Hello everyone and welcome to another show of Eyecare Today. I'm your host, Dr. Thomas Kislan. Joined with me today is Dr. James Deom, who sees patients in both our Hazleton location here on the Beltway in Hazleton, 453-2020, and also in our Stroudsburg location, Stroudsburg Eye Specialists, 570-421-3342 if there's any questions. And as always, check us out on the web at www.drkislan.com. Dr. Deom, thanks for joining us today.
My pleasure.
Giving all this great information to the folks out there watching. This is a second show where we're talking about something called dry eye disease. And let's briefly talk a little bit about some of the symptoms and treatments for dry eye, because what we were going to do in this segment, or in this show I should say, is talk about some more advanced treatments that are out there. So if some of the initial things aren't working and we need to do other things, what can we do? So just go over with the people watching out there what we've already kind of discussed in our last show.
Yeah, so I think big things are that this is a severely underdiagnosed condition. You may have it, you may have no idea you have it. Some of the very obvious, let's say, symptoms would be itchy, burny, scratchy, or teary eyes. Your eyes actually profusely tearing. We talked how last time, tearing of the eyes could be a reflex mechanism, the eye trying to fix the dryness, but it can't because it's not the right quality tears. So those are some of the things that we see patients actually complaining about. But the number one sign that we see people with and presenting with dry eye is fluctuation in their vision. So what does that mean, and when are we seeing that?
I think a big one for me is patients will say that they're driving at night and they can't see and they blink a couple times and things clear up. Or they're sitting at home on their iPad or iPhone or computer and doing their emails and things get blurry and they blink a couple times and it gets clear. That's fluctuating vision. And that, what we found through some research is that that's the number one predictor of not only patient has dry eye, but they have a condition that's probably going to get worse. It's a predictor for progression of the disease. So, all of us are now using more iPads, iPods, some sort of handheld device more, and the big thing is we don't blink as much when we use those, and that can make the dry eye worse. So that's one of the big clues. And just to give patients or people out there watching an idea, we talked in the last couple shows about macular degeneration and glaucoma. Each affects approximately 3 million people in the United States. Dry eye disease affects 30 million patients have this condition, and a lot of them are undiagnosed. So it's our goal here in Hazleton and Stroudsburg to diagnose all 30 million.
That's right.
And help them all. And hopefully what we're doing here will reach those patients.
And there's a reason for that, right? I mean, this is a serious condition. In the early stages, it's not something that many people are noticing is affecting their activities of daily living, but we don't see that. We see a lot of times, unfortunately, people that have gone years and years and years and years and years with different eye doctors, not here, of course, where they've been given artificial tears and said, here you go, take these artificial tears, take them when you need them, we'll see you next year. And we have to sort of break that cycle, which is sometimes difficult. But the end stage is where, people drop out of contact lenses. They can't wear contact lenses anymore, and they love wearing contact lenses, they can't do it. Or they're not able to perform their job. They can't look at a computer screen and perform their job effectively because their eyes are so painful they can't keep them open. So the important thing to know is that I think a lot of people hear dry eye, they think, oh yeah, everybody's got a little bit of that, not a big deal. Not true.
Yeah, and what's interesting, you brought up the job performance, and a lot of people don't think about it affecting their jobs, but it does. And in my 20 years of practice, I've filled out disability forms for patients for various conditions. This is the first year or so that I've actually filled out disability forms for patients because of dry eye disease. Yeah. So it can definitely affect not only their daily living, but everything that they do, their jobs and everything. So our goal is to prevent it from getting to the end stages. But unfortunately, we see patients who come in as new patients because they haven't been getting the proper treatments, and they're in this end stage. So what can we do for them at that point?
Yeah. So again, what we mentioned last time was that we treat patients on an evidence-based approach. That means that based on what we see and what you're telling us, we have a protocol of treatment options that we give to them, which has been studied and proven over many years. So we talked about drops last time. We talked about drops. We talked about supplementation with omega-3s, which we highly recommend the PRN, very high quality, highly absorbed into our system, utilized, not just excreted. We've talked about lid health and hygiene with some of the different scrubs out there. So many times patients will have already been on some of these things when they get to us. Many times. If they're not, I usually will start them on that and have them back a little bit sooner. But what if they're already on some of these things? Then what?
Well, then we have to go to things that are a little bit more involved, and we have 3 pieces of technology / science with us today that we're going to talk about. One is the Lipiflow technology, which again, proud to say we were the first practice in the area to have Lipiflow. The second piece of technology is something called MyBo-Thermoflow, which we are the only practice in about 5 states that have both of these technologies. And then we're going to talk about something called amniotic membranes. And this is, I think, some of the coolest technology that's out there now. And amniotic membranes have been around in medicine for a long time. Tell the folks out there watching, what is an amniotic membrane?
So an amniotic membrane is actually a preserved piece of human placental tissue. Human placental tissue has, and my wife is pregnant right now, love you, honey, and our future little baby, which we don't know what it'll be, but we're very excited. That is the placental, the reason that the placenta exists is to serve to protect and feed and nurture the fetus. And so it helps new cells grow on the fetus. And so what we found with that over many years is that this placental tissue can help reduce scar formation in individuals with severe burns and surgical closure of large wounds. So it's been just amazing in how this works. And important to note, it's not stem cells, okay? It's really not a controversial issue at all. This is a connective tissue protein that is natural, that is able to reduce scar formation and aid in healing like nothing else.
And I tell patients it can sometimes heal things 100 times faster than just a typical drop that maybe we give them. So this placental amniotic tissue has been used in medicine for years, and it's just recently gone into the eye care arena. And what we're going to do in the next segment, because we ought to take a quick break here, is talk about how amniotic tissue or this placental tissue can be used for the eye and healing. So you're watching Eyecare Today. We're going to take a quick break, and we'll be right back. Welcome back, folks. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan. Joined with me today is Dr. James Deom. We're coming to you from our Hazleton location on the Beltway in Hazleton, Pennsylvania, 570-453-2020, and in our Stroudsburg area, 570-421-3342. And Dr. Deom, last segment in our last show, this is a kind of continuation of our last show, talking about dry eye disease. We were talking about some more advanced treatments for this disease. So patients who have been progressing, even though we've done all the things that kind of need to be done, and it's still, because it can be a progressive disease, we were talking about amniotic tissue and how that is used in eye care to help with this disease. So I have in front of me here in a box, now this is a frozen membrane. It just came out of the freezer, but it is called a frozen amniotic membrane. Tell the folks out there how this works.
So this is just amazing, and I really feel privileged to be, first of all, in a practice that is as progressive as ours to be able to do this, but also in an age of healthcare delivery where we're able to preserve human placental tissue which is tremendously anti-inflammatory, pro-health, pro-healing, and place it on somebody's eye. It's really just spectacular. So what we have here is a ring. We're going to show you a picture now. A plastic ring, which is around the same size and shape as the white part of the eye, the sclera. And what we do is we usually gently anesthetize the eye so that the patient isn't really noticing us putting this onto the eye. So we gently give a drop. We will take the ring and place the ring on the eye, very much like a contact lens, the way that we do this. So patients who have had contact lenses, very similar to that, okay? So we're going to place it on the eye, and what this does is this ring has the placental tissue over top of it, okay? So when we put it on the eye, that placental tissue is going to be placed in direct contact with the cornea, and the cornea is what we feel. It's the part of the eye that feels things. When we have eye pain, itchy, burning, scratchy, teary, all that stuff, it's coming from sensation on the cornea. So healing the cornea is the main goal of this this treatment.
And you know, the ring, or the plastic ring, like you said, holds that membrane in place, and that membrane then over time, as we have it in, slowly dissolves away and releases all those good proteins and anti-inflammatory proteins that help to heal the cornea. And when this first came out, we thought we had to leave it on, you know, a week or 2 or 3 sometimes. But now we know that even just a couple days with this membrane in really provides tremendous benefit to these patients. And again, we'll have corneas heal so much faster than if we just use drops, let's say, or some of the other treatments that we've done in the past. And you know, it can be slightly uncomfortable. I tell patients, you know, it may feel like there's an eyelash in your eye for a day or 2, but I'll usually place these on a Monday and maybe take out on a Thursday. So a couple days they'll leave it in, and then taking it out is very simple. Again, we put a little drop in, numb the eye, and it gently slides out, and it's done. And what's interesting, you've probably seen this, is if the patients are really severe dry eye disease, the tissue will be totally melted away.
Right.
And
yeah, it's unbelievable to see, you know, with patients who have mild, moderate, severe, how they react with this on. You know, again, a hot eye, a really inflamed eye, an irritated eye, it's just going to utilize all that tissue there. Some are more moderate, you know, it may dissolve a little bit slower, but you know, it's good to see that, you know, when somebody comes back, it's all gone, because you know they've utilized all that pro-healing, anti-inflammatory things in that membrane. So just a really cool treatment, really proud to be able to do it here. Another I think important thing about this is it's covered by insurance.
right.
You know, this is something that, you know, a lot of patients are, when they come here for dry eye, concerned as far as finances go. You know, my co-pays, my insurance doesn't cover it, or it's an out-of-pocket treatment. Unfortunately, we do have, you know, some of those which are fantastic, and, you know, hopefully, you know, patients recognize the benefit of, and invest in that, because certainly it would be a beneficial investment. But with this particular treatment, thankfully, the insurances and so on have noticed the benefit of it and pay for it many times.
Right. And the other place we're utilizing this a little bit is, let's say patients come in with big scratches on their eye, or they have a piece of metal in the eye and we have to dig that metal out, and placing one of these on instead of just a patch on the eye or something like that has been shown to allow the eye to heal better and prevent problems down the road from these wounds kind of reopening up. So amniotic membranes extremely beneficial.
Awesome.
You know, before we have to take a break here, let's briefly talk about another piece of technology called the Lipiflow thermal pulsation. What is Lipiflow?
Lipiflow, again, a wonderful in-office treatment that we do, really very unique. Again, we're the only ones in the area that offer it. Really can change the way that eyes feel. You know, the purpose of Lipiflow thermal pulsation is to directly treat these oil glands that we keep talking about in our eyelids. So important. And you know, I think, you know, just to step back a moment, these oil glands, if they're not producing the right secretion, they're not producing the right quality or quantity, they get blocked up, they die, they never come back. They never come back. So treating them is very important. So when we see atrophy of the oil glands, we want to get at that as soon as we can. So many times we'll tell patients, go home, do some warm compresses. But the problem with warm compresses is people don't do them. they take up time, they're not effective, okay? They're not effective. They don't get the heat to the gland. So the purpose with the thermoflow or the Lipiflow is to provide that heat with an applicator. This applicator sits on the eye, provides the heat underneath the eyelid, and it pulsates to pump that oil, the diseased oil, out of the lid. So how long does it last? How does it feel?
Well, when we first brought Lipiflow technology in the office, we did a whole show on the Lipiflow, and I've actually had it done. It doesn't hurt. In fact, it's kind of soothing. It's almost like having a little eye spa treatment. It's a nice, warm kind of feeling. You do feel a little bit of a pulsation. It's almost like someone's gently touching your eyelid. But that pulsation is like you said, the old diseased oils being kind of squeezed out of the oil glands, and that allows the oil glands to start producing new oils. So Lipiflow is really a painless treatment that can provide a lot of benefit. And in some patients it lasts maybe a year to 3 years. In other patients maybe not as long. It depends how far progressed their disease actually is. So Lipiflow is some great technology, and we'll talk a little bit more about it in the next segment, but we have to take a quick break here again. So we'll be right back. We're talking all about dry eye disease and some of the great treatments here we offer at Hazleton Eye Specialists. So we'll be right back. Welcome back, everyone. You're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, joined by the great Dr. James Deom. And we're talking about dry eye disease here in Hazleton on the Beltway. Hazleton Eye Specialists, 453-2020 in Stroudsburg. Our location there is on 9th Street, 570-421-3342. Our website's www.drkislan.com. And the last show we did talked about some of the early treatments we have for dry eye. This show we've been talking about some of the more advanced treatments. We talked about amniotic membranes. We finished up the last segment talking about Lipiflow thermal pulsation. And just to kind of review, Lipiflow is where we had these applicators that go onto the eye. We numb the eye, patients don't feel it, and very gently provides, it's a 12-minute treatment. Both eyes are treated at the same time. Gentle heat and pulsation that helps the oil glands to get rid of the old oils and start producing new oils. So that's Lipiflow. That sums it up, I think.
Yeah, and I think
good.
the bottom line is most people aren't going to even know that this is an option. And we're the only ones in the area that have it. If you're suffering and you've tried a lot of the things that we've mentioned in our first show and even briefly in the beginning of this show, Lipiflow could be the answer for you. So come and allow us to evaluate you, take a really thorough look at the quality of your tears, the structure and function of your eyelids, and let us see if you're a good candidate for Lipiflow, because not everybody's a candidate. Right. So you don't just come in and say I'm going to get Lipiflow. This is a medical procedure. It's a very comfortable procedure. It's a very effective procedure, but we prescribe it, and if you're a candidate for it, we'll definitely recommend it for you.
And an adjunct to all of the treatments we're talking about are omega-3s, and I think it's very important for patients out there to know. We talked in the last show that dry eye is inflammatory in nature, and omega-3s, a good omega-3 like the PRN dry eye omega benefits, has potent anti-inflammatory benefits, but it also helps to get healthy oils into the oil glands. And we do some of these procedures. You want healthy oils in your oil glands. You go get your oil change in your car, they don't put the old oil back in. Right. So when you do one of these treatments, you want new healthy oils in your oil glands. So the omega-3s are very important. The other treatment we have, and again, proud to say we are the only ones in the area, and I think there's only one or two others in the whole state of Pennsylvania that have something called Thermoflow. What is Thermoflow? And that's what we see right over here on my right here, and I'll hold the probe to it here.
So, the MyBiflow, really one of my favorite new technologies that we are offering here at Hazleton and Stroudsburg Eye Specialists. This is the applicator, and so what we do here is, again, similar to Lipiflow, is we're going to be providing heat and massage. However, the difference with this is that the heat and massage, as opposed to being applied from underneath the eyelid, from the inside, it's actually going to be applied from the outside. So we're going to be massaging gently the outside of the lid, very gently, with some ultrasound jelly, okay? So the ultrasound jelly really neatly helps permeate the heat through all the layers of the eyelid, the skin, the connective tissue, the muscle, the vasculature, to the glands, which are on the inside, which is the reason why Lipiflow is so effective. But the ultrasound jelly here with the MyBiflow helps do that same thing, so it's very comfortable. The nice thing I like about the MyBiflow is that we will often recommend patients with a series of treatments. So what does that look like?
Yeah, so like you said, the ultrasound jelly goes right on the tip, and then that's massaged over the eyelid. And we'll actually show a little video here while we're talking of what that kind of looks like. But it's very, very soothing, and the treatment lasts anywhere from 8 to 12 minutes, depending on what we prescribe. But what's interesting is this can be repeated very easily. And whereas Lipiflow maybe requires one treatment over a certain amount of time, this will do maybe every 3 to 4 months. And there are some cost differences. What I tell patients is Lipiflow costs more, but lasts a little bit longer. And part of that cost being higher is because the applicators that we use, the FDA, when they approved the machine, said they had to be disposable. So we're not allowed to sterilize them and reuse them on patients. They have to be used and then just thrown away, one-time use, and that adds to the cost. Right. Whereas MyBiflow, the tips are just, this is a stainless steel tip, and this can be sterilized very easily, and this can be used multiple times on patients and repeated whenever we need to. So if a patient after 3-4 months is feeling uncomfortable again, we can do another treatment. And we do have some programs set up. We call it the Dry Eye VIP program. Maybe you can explain a little bit how that works if patients need multiple treatments.
And I think one of the things which I don't think we've said at all, and I just can't believe as I'm sitting here that we didn't say it, but dry eye is a chronic disease. And this condition often will need repeat treatments, right? So that's why we like the MyBiflow so much, is because we can treat it chronically, because it is a chronic condition, which means it doesn't go away. We need to continue to treat it, but we can often do it very effectively. So our dry eye VIP program, really just a wonderful option for patients who do have any level of dry eye. Really, it's available to you, and the purpose of this is to be able to give you a year's worth of MyBiflow treatments, doctor prescribed MyBiflow treatments. So we'll separate them for you based on your level of dry eye. So it's a one-time fee, and then you're part of this treatment. The other thing you'll get is a bottle of our omega-3, the dry eye omega-3, which we believe, again, we're getting rid of that diseased oil, and we're going to replace it with good, healthy oil. What other things do we get with the dry eye?
And Lipiflow, if the patient does need Lipiflow, because sometimes we need to combine some of these treatments for total effectiveness, Lipiflow will be gotten at a little bit lower cost than what it usually is just by itself. So we understand that these treatments are expensive in some cases, but really when you look at the effect that they give, they really help.
And I look at it as an investment, right? It's an investment to your health, it's an investment to your future, and to your eyes. It's eye love, right?
It is eye love.
It's eye love.
As Jennifer Aniston is. But yeah, you're right. And like you said, dry eye is a chronic condition. So even though we're treating it now, if we don't do anything, in 5 years it's going to be worse.
And it's going to be harder to treat.
It's going to be harder to treat. It's going to be more difficult to get patients comfortable. And it's, again, that vicious cycle we've talked about. And again, 30 million people out there in the United States suffer from this disease. So again, like you said earlier, we're very proud here that we are on the cutting edge for dry eye disease. We can proudly say that there's nobody around that has all of this at patients' disposal. So if you're watching from the Hazleton area, the Stroudsburg area, any other area where this show is reaching, please feel free to call our office and make an appointment to see any of our doctors here if you think you're suffering from dry eye disease. It's been a pleasure talking to the patients out there today about dry eye. Thank you, Dr. Deom, for joining us today again. Ladies and gentlemen, you've been watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and we'll see you next time.